Wisconsin's Governor Evers has released his biennial budget draft for the state of Wisconsin. It includes a number of healthcare and coverage priorities. We're going to take a couple minutes to talk about that today. This was first released on February 28th when Governor Evers gave his budget address to the people of Wisconsin. It follows some executive orders that Governor Evers had signed on his first full day in office. A lot of the priorities are echoing into the budget priorities. So we saw a priority on access to health care and coverage, a priority on women and children's health, and on innovation in reducing health disparities. The Department of Health Services budget, the budget coming out of the Department of Children and Families, is echoing a lot of those priorities. What we're seeing, first and foremost, is an attempt to expand Medicaid. That's where a lot of the money can come into the budget that can then be invested in other healthcare priorities. Governor Evers proposes right at the top that we would expand Medicaid in the state of Wisconsin from 100% of the federal poverty level to 138%, following the model of a lot of other states that have done that type of expansion and claimed the federal money to do so. This would add at least 82,000 people to Badger Care Plus in the state. It would save the state of Wisconsin over $300 million, and net Wisconsin $1.5 billion if you count the federal money coming into the state. That's a lot of money that can then be invested back into healthcare services and programs to help reduce uncompensated care and make Wisconsin a little bit healthier. That's the premise of this part of the state budget, is we need that federal money that we can invest exclusively back into the healthcare systems. If you start looking at some of the provisions of the budget that outlines the populations to be served, first and foremost in that category is the reduction of infant mortality. Wisconsin, especially in Milwaukee and Dane County, have seen dramatic disparities in their infant mortality among different races. What the budget does is try to prioritize the way that health departments can build their infrastructure and other investments that can be made to make sure that women and children are healthier through the birth into postpartum care. As a side note on treating infants and pregnant women a little bit better, there is the elimination of the birth cost recovery policy written into the state budget. This is something, if you're a regular watcher of Video Case Tips, you've heard us talk about quite extensively. The policy in the Medicaid program to collect birth costs from absent parents has been attributed to impacting birth outcomes, and it is treating unmarried families in Wisconsin differently than married families. The state budget says get rid of that policy. That's something that we're really happy to see in that budget, and it kind of carries along with that treating pregnant women and infants in their first year of life a lot better from the State Department of Health Services perspective. Along those same lines, Governor Evers says let's expand postpartum coverage while we're at it. In the Medicaid program for women on Medicaid, typically the coverage will last 60 days postpartum. Well, what the budget proposes to do is expand that to a full year. Right now we have something called continuously eligible newborn coverage for a newborn to have Badger Care Plus or Medicaid for their first year of life, no matter what changes happen within the family. This would be a similar provision for the pregnant mom, now a parent, to have that same type of extended coverage to make sure that she was getting the follow-up care that she needed. Then there are other things. If we have a pool of over $1 billion that can be invested in our healthcare programs, this budget envisions spending some of that on increasing reimbursement rates. Just as important is expanding reimbursement rates for dental and expanding dental access in the state of Wisconsin. Wisconsin is not doing a really great job in access to dental care for its Medicaid population. This budget says we want to change that. A couple other provisions. Look at telehealth. Now, they had a priority on innovation and seeing if there were new ways to reach patients, especially in rural or disparity areas. Telehealth was prioritized as one of the ways to do that. Another way to reach people in remote parts of the state is to expand eligibility for different types of programs like the Birth to 3 program. The Birth to 3 program in the budget would be expanded to make sure that children, any child that has an elevated lead level, could be included in eligibility for Birth to 3. So you're seeing a lot of innovation and creative thinking coming from lots of different angles of how we can get more people, especially women and children, connected to more services. That same type of thinking is also applied to the behavioral and mental health population. How can we help counties share the burden for crisis services? And there's an excessive amount of money, over almost $40 million, that is projected to be spent on that coming out of this Evers draft budget. One of the areas you've probably heard quite about in the news is the community health benefit. This is a way that the Evers administration, again thinking creatively, has said, how can we address the social determinants of health? Not just the instance after instance of care, but the community and the environment around the patients that might be impacting health outcomes. And there's, again, an over $40 million investment in the community health benefit to develop technology, to develop innovations, to break down geographic barriers, to make sure that we can address those other issues impacting a child or a family's health, that we could break down and be a little bit more preventative, and then make sure that the family has access to the care and coverage that they need. And then we have a category of everything else. There's quite an excessive amount of information in this budget on the health priorities of the state of Wisconsin, and it covers things like eliminating the children's long-term support waiting list for the waiver, eliminating work requirements and co-pays in Badger Care Plus, that new rule that the last administration has signed into law but has not yet been implemented. A lot of that is tied up in litigation right now, but the budget and projecting its priorities say we don't want these things as part of our Medicaid program. Similarly, it eliminates parts of that 2017 Wisconsin Act 370 that require legislative approval on waivers. That again came out of that lame duck legislative session at the end of 2018, putting restrictions on the powers of the new administration. This budget again is saying we don't like that. We don't want that to be part of what we fund and the priorities of this state. And then we see programs that, some priorities that make adjustments to the FSET program. And this is starting to look at work requirements and drug testing in the food share program. And so this budget is tackling that, and there's an extensive amount written on that. There's even more. There's Medicaid prescription drug copays that are knocked out. There's additional enhancements in women's health and cancer screenings that we haven't even gone into. There is caregiver task force that are created, changes to the Women, Infant, and Child, the WIC program, personal care services. So this is a budget, and we're going to share the link to both the budget and the budget in brief so you can give it an overview and read a little bit more on some of these areas. Let's talk about what's next. So this was the proposed budget coming out of the governor. And as you know, in Wisconsin, we have a different political party for our governor than we do for our legislator. So the Joint Finance Committee, no matter what the political environment, always gets the first review of the governor's recommended budget. We have an Assembly bill and a Senate bill right now. Both are budget bills. They will be reviewed by the Joint Finance Committee. There will be briefings. There will be public hearings. Then the Joint Finance Committee will prepare its own version of the budget, and they have projected that they certainly intend to do so. The priorities coming out of our Republican legislature are very different than the priorities coming out of our Democratic governor's office. So you can expect that there will be some changes proposed out of the Joint Finance Committee. Once the bills are introduced in the Assembly and the Senate, there has to be consensus between the two bills, which means a conference committee will reconcile the two bills, the Senate version and the Assembly version. Once there's consensus, it goes to the governor to sign. Now, even though the legislature has the ability to make some pretty dramatic changes to the budget, in Wisconsin, our governor has the line item veto power. So he could cross out sections of that budget that he doesn't like. This could be a very contested and very heated process. It has been in the past, and it could be again. There are a lot of priorities that are very mismatched of these legislature and governor's office. The goal is to have a budget by the start of the state's new fiscal year, which is July 1st. We will keep you posted on some of these, how these healthcare priorities shake out as that budget works its way through the political process. We will also keep you posted on when public hearings are and when you have an opportunity to raise your voice of some of the priorities you want to see in the state budget, how you want your money to be spent on some of these healthcare issues. We provide you the link to the Department of Health Services website, where they have an interactive website on the different priorities that we reflected here in some of our slides. And we also send you directly to the Department of Administration's website, where you can read that budget document and budget in brief for yourself. In the meantime, you can stay connected to us at healthwatchwisconsin.org, where you can send us your questions or an email or share some of your healthcare stories as well. Thanks for watching.